Hello viewers, welcome to our YouTube channel. Today, on behalf of Poribesh Sathi, we are going to organize our first YouTube session on various educational as well as environmental topics. Before starting the session, I, Madhurima Kanji, member of Poribesh Sathi, going to introduce our renowned speaker, Dr. Joyjit Mojumdar. Dr. Mojumdar is presently working as an assistant professor at Department of Ecological Studies, University of Kalyani, Nadia, West Bengal. He has more than 7 years of teaching experience. He obtained his PhD from the Department of Environmental Science, University of Kalyani. From 2008 to 2009, he worked as MHRD Indo-Belgium Fellow in Department of Biology at Antwerp University, Belgium. Thereafter, from 2010 to 2013, he worked as an UGC Meritorious Fellow. He also worked as Junior Research Fellow in School of Environmental Studies at Jawaharlal Nehru University. He has research experience on different vast and versatile areas of biogeochemistry, geochemistry, microbiology and molecular biology, toxicology and bioremediation, environmental biotechnology, and ecosystem services. Now, we present to you the valuable lecture of Dr. Joyjit Mojumdar on the topic of COVID-19 pandemic, a burden of biomedical waste.
Hello. Good afternoon. Today I am going to deliver a lecture on COVID-19 pandemic and its burden of biomedical waste. Thanks Poribesh Sathi for giving me this opportunity. If we go through the human civilization, human society has experienced lots of pandemic and epidemic situation which dates back to 5,000 years ago, almost 3000 BC. An excavation site in northeastern part of China revealed that mass burial ground for dead bodies, and dead bodies were put into a large house, and subsequently it was burned down. And that archaeological site is now called as Hamin Manga. A similar type of burial ground was also found in Mianjigu region of the northeastern part of China, and both of these two burial sites are thought to be result of same pandemic, and the source of the pandemic is still unknown to us, and it did not spare any single age group. Another great example of pandemic occurred during the 430 BC, which lasted almost for 5 years, and during the period of Athens and Sparta war, it approximately killed 1 million of people, and the symptoms of the disease includes violent heats in the head, redness and inflammation in the eyes, inflammation in inward parts such as throat and tongue, and body becoming bloody and emitting unnatural fetid breath. And due to this pandemic, Athens succumbed to Sparta. The Antonine plague, which occurred during the period of 165 to 180 AD, and it is thought to be a case of smallpox where almost 5 million people was killed due to this pandemic. And plague of Cyprian, it originated in the northern part of Africa, named after Saint Cyprian, the city located in Tunisia. The symptoms involved irregular bowel movements, relapse into constant flux, discharge of bodily fluid, along with fire-originated marrow and wounds in the fauces, and almost hemorrhagic fever like Ebola. And Cyprian plague killed approximately 5,000 people per day in Rome only. And the bodies were buried under thick layer of lime, as lime was the only known disinfectant during that period. And archaeological studies revealed that three kings which were responsible for making lime. The plague of Justinian prevailed during the period of 541 to 542 AD, and it occurred in the city of Constantinople, which is now known as the Istanbul. And historians and archaeologists thinks that it wiped out almost 10% of whole world population. The Black Death, which occurred during the period of 1346 to 1353, and it spread from Asia to Europe. The causal organism is Yersinia pestis, which is extinct now, and it was spread by fleas from the infected rodents, and bodies were mass graved. The Cocolizili epidemic, which occurred in Mexico and central part of America during the period of 1545 to 1548, the symptoms were hemorrhagic fever caused by strain of Salmonella paratifici. And enteric fever symptoms were high fever, dehydration, gastrointestinal problems, and it is still a major problem in present day situation. The American plague occurred during 16th century, and it is thought to be the European explorer brought the smallpox to American continent and almost wiped out 90% of the indigenous population of Western Hemisphere. And Aztec and Mayan civilization succumbed to it and subsequently conquered by the Spanish Armada. The Great Plague of London occurred during the period of 1665 to 1666. During the period of April, it spread rapidly in London and adjoining areas during the summer months. Almost 1 million people were dead, including 50% population of London itself. And it was followed by the Great London Fire, which lasted for 4 days and almost wiped out large portion of the city. The Great Plague of Marseille occurred during the period of 1722 to 1723. It is the one ship that's called Grand Saint Antonio was docked in Marseille, and crew members of the ship were ill. So the ship was quarantined, but somehow the infection spread over the city by fleas from the infected rodents, and it killed 1 million people in Marseille and adjoining areas. It is estimated that 30% of total population of Marseille was perished. The Russian plague occurred during the period of 1770 to 1772, and 1 million people have died, and the pandemic ravaged the Moscow, and the whole city was in quarantine, but citizens erupted into violence and killed almost all government officials during that period. The Philadelphia yellow fever occurred during 1793 and transmitted by mosquitoes, and more than 5,000 people have died due to this pandemic condition. The flu pandemic, which started from Russia, spread globally during the period of 1889 and 1890. Due to modern civilization, the spread of the influenza virus was very fast, and it just peaked as mortality within 5 weeks of the starting of infection and killed almost 1 million people. The American polio epidemic occurred during the period of First World War. Polio epidemic that started in New York City caused almost 27,000 infection along with 6,000 deaths. The Spanish flu, which occurred during the period of 1918 to 1920, it is the largest pandemic before this COVID-19 pandemic, and it is estimated that more than 500 million people from Antarctic to North Pole succumbed to this pandemic, and 1/5 of these infected person died. And the symptoms includes the hemorrhage in lungs and other body parts. The Asian flu that occurred during the period of 1957 to 58, and it is thought to be a virus from avian sources, and it almost killed 1 million people. And AIDS pandemic, which is still going on from 1981, and only 2 people have survived till date now. The swine flu pandemic during 2009 and 2010, and it is caused by the virus strain called H1N1 and originated in Mexico, and 1.4 billion people across the globe was infected and killing approx 1.5 million people. The West African Ebola pandemic, which occurred during the period of 2014-2016, and Ebola ravaged almost infected 29,000 people during this period and caused almost 11.5k deaths. Still, there is no cure for Ebola. So researchers are looking for the proper vaccine for tackling this epidemic. And the virus is originated from bats. The Zika virus pandemic, which is still in existence from 2015, and Zika virus is spread to mosquitoes of Aedes genus, and its symptoms includes hemorrhagic fever. Symptoms are not so severe in adults and children, but infants who are still in womb are highly affected with birth defects. Now I'm going to the present day situation, the SARS-CoV-2 or the COVID-19, the severe acute respiratory syndrome, which is originated from Wuhan region of China. It, like all the animal viruses, it is also RNA virus with corona-like encapsulation, and primary host is the bat, and it came to human from intermediate host like pangolin or from the direct consumption. I'm not going into details. I now will focus on my main topic, that is the biomedical waste generated during this pandemic situation. Prior to pandemic, the Wuhan city itself was generating 40 tons of biomedical waste per day, and which increased to 240 tons biomedical waste per day now. A joint report prepared by Association of Chamber of Commerce and Industry of India, ASSOCHAM, and the Velocity, they said that in 2018, in India, 550 tons of biomedical waste is generating per day, and which likely to be increased by 775 tons per day by 2022. And they did not consider the present pandemic conditions. And now, from 2019 to present day, the amount of biomedical waste increased sixfold. So it's creating an immense pressure on the biomedical waste management facilities and management authorities. Although India have a very good biomedical waste handling and management rules, which came into action during the July 1998 and further amended in March 2016. And due to this pandemic condition, CPCB also included some guidelines to tackle the biomedical waste for this COVID pandemic situation. The major waste generated for this pandemic battle are mask and surgical gloves, which are yellow of category due from the classification code issued by Government of India and CPCB. Gloves are in red. Syringes and needles IV kit, they are red and blue in category. Hazmat suits, they are red in category. Saliva, blood samples and other tissue samples are red category. Used test kits are in red category. Splash-proof apron red. Goggles, face shields, they are also red. Plastic overall suits, which is generated due to handling the hospital waste as well as isolation ward, and it is also of red category. Soiled bandages and tapes, which is also of yellow category. Packing material for the personal protective equipments as well as the IV and syringes, they are of yellow category if they are infected, and if not infected, then they are green category. Corpses, and as we all know, there are almost 3% people are dying for this COVID-19 infection. So CPCB has clearly started giving pictorial notice and other guidelines to different hospitals and healthcare facilities which are tackling the pandemic situation. As per biomedical waste management rules, there should be 4 different categories of container: yellow, red, blue, and white, to segregate the waste generated in isolation wards and other parts of hospitals. But the pressure is immense, so chaos is occurring now. This picture can reveal the present day situation of biomedical waste burden. This is the personal protective equipments, gloves, masks, and other things dumped in the crematorium near Lodhi Road, New Delhi. This used PPE kits dumped into a garden in a busy commercial area of Bengaluru. This picture is from Maidan region of Kolkata, and this picture is from Lucknow, Uttar Pradesh, where kids are carrying firewood in used hazmat suits. There are several other pictures from Coimbatore, stray animals spreading these used PPE kits, hazmat suits, flyovers in Bengaluru, near highway in Patna, and this is one of the major strand road in Patna. And people from slum areas and school-going kids are playing with the used gloves and other PPE equipments. This is not only a picture from India. In case of USA also, lots of biomedical waste is being found near the freeways, along with the freeways. And this is not only larger cities are affected from the biomedical waste, small town like Kalgani itself are also affected. Lots of abundant PPE kits are found in the roads of Kalgani region. Now, I'm going to the treatment of biomedical waste, and this involves 5 basic procedures: the chemical process, thermal process, mechanical process, irradiation process, and biological process. The chemical disinfection majorly done by hypochlorite solutions of sodium hypochlorite or calcium hypochlorite. This must contain 0.5% of chlorine, which can kill the virus and as well as other pathogens. The category of biomedical waste classified, as I have earlier mentioned, in 4 categories. Yellow contains the human anatomical waste, animal anatomical waste, expired discarded medicines, chemical waste, chemical liquid waste, discarded linen, mattress, soiled bandages and other waste, and microbiological, biotechnological, pathological lab waste. Red contains the contaminated waste. White contains the sharps and metals, and blue contains the glassware and the metallic body implants. And these have different process of treatment procedures. For the incineration of waste, that is for red category waste, a complete effective incineration is needed. The combustion efficiency should be more than 99%. And CPCB has mentioned their exhaust criteria. The particulate matter should not exceed 50 microgram per meter cube. Oxides of nitrogen should not exceed 400 microgram per meter cube. HCl should not exceed 50 microgram per meter cube. Where total dioxin and furan should not increase 0.01 nanogram per meter cube. And mercury and compounds 0.05 microgram per meter cube. And the cleans where the incineration is taking place should be more than approximately at least 30 meter of height. So for the autoclaving process, as basic autoclaving method, 121 degrees centigrade needed at 15 psi and not less than 60 minutes of autoclaving. If it is done in 135 degrees centigrade, then the psi should be 31 and minimum time would be 45 minutes. If it's done in 149 degrees centigrade, the psi should be 52 and it should not be less than 30 minutes. And the managers of who are handling the biomedical waste should check their operational parameters regularly, and their process of autoclaving and other chemical disinfection and routine tests should be performed regularly, once or twice a week, or once in a month. So for the after the incineration, or those waste which should be directly buried, should be buried into pit approximately 2 meters deep, and the half of the pit should be filled with the biomedical waste. Then a thick layer of lime, approximately 50 centimeter, should be dumped over the biomedical waste, and rest of the pit should be filled with soil. For the efficacy of chemical disinfection, kill curve study by Bacillus subtilis should be performed regularly, and for his sterilization, temperature should not be below 185 degrees centigrade for a sustenance period of 150 minutes for each cycle, with sterilization period of 90 minutes. And this waste should be further tested for the microkill curve test itself. The liquid was generated during the management or treatment of hazardous waste. CPCB and Government of India also have given some criteria. The pH of effluent should be in the range of 6.5 to 9. The suspended solid should not exceed 100 mg per liter. Oil and grease should not exceed 10 mg per liter. BOD should not exceed 30 mg per liter. COT 250 mg per liter. And bioacid test should be effective if 90% survival of fish after 96 hour of growth in 100% effluent. And sludges from the liquid waste effluent treatment plant should be directly sent to solid waste management facility for further incineration or recycling process. So CPCB has distributed pictorial guidelines to different healthcare facilities how to tackle with the huge amount of biomedical waste, different containers, and how their time and should be managed to deliver the hospital waste regularly to managers of biomedical waste. And it is very important to segregate the different types of waste according to its waste category. Segregation is an easy process. It should be done carefully, and it is advised to not to mix different types of waste. And if a spillage occurred during the transport of waste in the hospital itself or in the biomedical waste management facility, that should be immediately taken care of by using disinfectant spray or cleaning by mops, and subsequently the clothes or whatever material they are using, that should be dumped properly for recycling process or for further management of waste. And the cleaning persons and the people who are handling the biomedical waste should take their personal precautions such as masks, gloves, face shields, head caps, shoe covers, and splash-proof aprons, etc., etc. And it is advised that people should not mix general waste with the biomedical waste, so the burden will be less. There, it is needed to transport biomedical waste from the source to facility by proper vehicles and carts. And if someone gets injured during the process, it is advised that they should not squeeze or scrub or suck the wound, and no alcohol is permitted to clean the wounds. And it should be washed under running tap water, washed and followed by washing with soap, and immediately to check with healthcare professionals. It is always suggested to not to mix different types of waste, and segregation is an easy process and which can be done by any person. And Government of India, CPCB, and Pollution Control Board of Delhi have developed Android-based application that is called COVID-19 BWM. This is very useful for who are handling the biomedical waste from hospital and medical facility itself to the who manages the biomedical waste, and the amount of different category waste can be easily calculated, and how much amount is going for landfill, how much amount is going for incineration, how much is going for disinfection and recycling can be easily calculated through this app. So it is suggested that the biomedical waste handler should always take protective measures when handling the biomedical waste, and they need to keep themselves mentally awake when handling contaminated waste, as we all know COVID-19 is highly contagious, and different types of biomedical waste should be collected separately and should not be mixed together. And amount of biomedical waste generated per day and biomedical waste sent for the management facility should be recorded by its weight, and the healthcare professionals and the cleaning professionals and the biomedical waste handlers should check their health frequently. So I am stopping here, Raya. Thank you very much, and thank Poribesh Shati for giving me this opportunity to give a lecture on biomedical waste generated during this pandemic situation. So stay healthy, avoid mass gathering, and stay safe. Thank you.